The Silent Thief: Understanding and Overcoming Myocardial Infarction. The human heart, a tireless engine, beats approximately 100,000 times a day, pumping life-giving blood throughout our bodies. We rarely acknowledge its tireless work until something goes wrong. When that something wrong is a myocardial infarction, a heart attack, the consequences can be devastating and life-altering. This book is dedicated to understanding this silent thief, empowering you with the knowledge to recognize its signs, mitigate its risks, and navigate the road to recovery. Unveiling Myocardial Infarction: The Anatomy of a Heart Attack. So, what exactly is a myocardial infarction? To understand it, we need to delve into the heart's vital function and its vulnerabilities. The heart muscle, known as the myocardium, needs a constant supply of oxygen-rich blood to function properly. This crucial supply comes from the coronary arteries, which wrap around the heart. A myocardial infarction, commonly referred to as a heart attack, occurs when one or more of these coronary arteries become blocked, severely reducing or completely cutting off blood flow to a part of the heart muscle. The main culprit: plaque and blockage. The most common cause of this blockage is atherosclerosis, a condition where plaque, composed of cholesterol, fat, and other substances, builds up inside the arteries. Over time, this plaque can harden and narrow the arteries, making them more susceptible to rupture. When a plaque ruptures, a blood clot forms at the site of the rupture. This clot can quickly grow large enough to completely block the artery, preventing blood from reaching the part of the heart muscle it supplies. Deprived of oxygen, the heart muscle cells begin to die. This cell death is the infarction, and the extent of damage depends on the size of the blocked artery and the duration of the blockage. Decoding the signals: Recognizing the signs of a heart attack. Time is of the essence when it comes to a heart attack. Recognizing the symptoms quickly can significantly improve the chances of survival and minimize long-term damage. While symptoms can vary from person to person and between men and women, here are 4 key signs to be aware of. Chest pain or discomfort. This is the most common symptom. It can manifest as pressure, squeezing, tightness, fullness, or pain in the center of the chest. It might last for more than a few minutes or come and go. Pain radiating to other areas. The pain can spread to the arm, typically the left arm, shoulder, neck, jaw, or back. Shortness of breath. This can occur with or without chest discomfort. Other accompanying symptoms. These may include nausea, vomiting, lightheadedness, sweating, or a feeling of impending doom. It's important to remember that not everyone experiences all of these symptoms, and some people, particularly women, may experience atypical symptoms like fatigue, back pain, or abdominal discomfort. It's always better to err on the side of caution and seek medical attention if you suspect a heart attack. Heart attack versus myocardial infarction. Is there a difference? The terms heart attack and myocardial infarction are often used interchangeably, and for good reason. They essentially refer to the same event, damage to the heart muscle due to a lack of blood flow. Myocardial infarction is the medical term, while heart attack is the more common layman's term. Think of it like this: a heart attack is a myocardial infarction. A heart attack versus cardiac arrest, a critical distinction. While both heart attack and cardiac arrest involve the heart, they are distinct conditions with different causes and treatments. A heart attack, myocardial infarction, as we've discussed, is caused by a blockage in a coronary artery, preventing blood from reaching the heart muscle. Cardiac arrest, on the other hand, is the sudden and abrupt loss of heart function. This is usually caused by a dangerous arrhythmia, irregular heartbeat, that prevents the heart from effectively pumping blood. Cardiac arrest can be triggered by a heart attack, but it can also be caused by other factors, such as electrical problems in the heart, drug overdoses, or trauma. Unlike a heart attack, during cardiac arrest, the person will be unresponsive, not breathing normally, and have no pulse. Cardiac arrest requires immediate CPR, cardiopulmonary resuscitation, and defibrillation, electric shock, to restore a normal heartbeat. Act fast. What to do when a heart attack is suspected? Knowing what to do during those critical moments can save a life. If you or someone you know is experiencing symptoms suggestive of a heart attack, call emergency services immediately, 911, or your local emergency number. Don't delay. Let the dispatcher know you suspect a heart attack. If possible, chew and swallow an aspirin, unless you are allergic. Aspirin helps prevent blood clots from forming. Stay calm and wait for the ambulance. Avoid unnecessary movement. If the person becomes unresponsive and stops breathing, begin CPR if you are trained to do so. Diagnosing the damage, how an MI is confirmed. Diagnosing a myocardial infarction involves a combination of factors. Electrocardiogram, ECG or EKG. This test records the electrical activity of the heart and can often identify specific patterns that indicate a heart attack. Blood tests. Blood tests can detect the presence of cardiac enzymes, such as troponin, which are released into the bloodstream when heart muscle cells die. Echocardiogram. This ultrasound of the heart can assess the heart's structure and function. Coronary angiogram. This involves injecting dye into the coronary arteries and taking X-ray images to identify blockages. Treatment options: restoring blood flow and repairing damage. Treatment for a heart attack focuses on rapidly restoring blood flow to the blocked artery and minimizing damage to the heart muscle. Common treatments include medications: aspirin, nitroglycerin, clot-busting drugs, thrombolytics, and other medications are used to reduce pain, prevent further clotting, and improve blood flow. Angioplasty and stenting. This minimally invasive procedure involves inserting a catheter with a balloon at the tip into the blocked artery. The balloon is inflated to widen the artery, and a stent, A small mesh tube is often placed to keep the artery open. Coronary artery bypass grafting, CABG. This surgery involves taking a healthy blood vessel from another part of the body and grafting it onto the blocked coronary artery to bypass the blockage. Chapter 8: The Road to Recovery, Rebuilding Your Heart and Your Life. Recovering from a heart attack is a journey that requires patience, dedication, and lifestyle changes. Cardiac rehabilitation. This structured program includes exercise, education, and counseling to help patients regain their physical and emotional health. Medication management. Taking prescribed medications as directed is crucial for preventing future heart attacks. Lifestyle modifications. Adopting a heart-healthy lifestyle is essential for long-term recovery. This includes healthy diet, eating a diet low in saturated and trans fats, cholesterol, and sodium. Regular exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Smoking cessation. Quitting smoking is one of the most important things you can do for your heart health. Stress management. Finding healthy ways to manage stress, such as yoga, meditation, or spending time in nature. Weight management. Maintaining a healthy weight can reduce your risk of future heart problems. Can you fully recover? The hope for a new normal. While the heart muscle that has died during a heart attack cannot be regenerated, it is possible to live a long and fulfilling life after a heart attack. The degree of recovery depends on the extent of the damage, the speed of treatment, and the individual's commitment to lifestyle changes and medication management. Cardiac rehabilitation plays a significant role in improving quality of life and increasing longevity. Understanding the risk factors and prevention. Knowing the risk factors for heart attack can empower you to take proactive steps to prevent one. Key risk factors include high blood pressure, high cholesterol, smoking, diabetes, obesity, family history of heart disease, gender, physical inactivity, stress. Many of these risk factors are modifiable, meaning you can take steps to reduce your risk through lifestyle changes and medical management. Regular checkups with your doctor are essential for monitoring your risk factors and making necessary adjustments. The silent heart attack, a hidden threat. A silent heart attack, also known as a silent myocardial infarction, SMI, is a heart attack that occurs without noticeable symptoms or with very mild symptoms that are easily dismissed. Because the symptoms are subtle or absent, people often don't realize they've had a heart attack, and it may only be discovered later during a routine ECG or other medical test. Despite being silent, SMIs can still cause significant damage to the heart and increase the risk of future heart problems. They are more common in older adults, people with diabetes, and women. Epilogue: Embracing a heart-healthy future. A myocardial infarction is a serious event, but it doesn't have to define your future. By understanding the risks, recognizing the symptoms, and taking proactive steps, you can protect your heart and live a long, healthy life. Embrace a heart-healthy lifestyle, stay informed, and listen to your body. Your heart will thank you for it.